The BioFINDER group at Lund University in Sweden presented the results of blood testing in patient populations, a primary care setting and a secondary care setting, as compared to a blood test alone. And what they found was maybe not that surprising to clinicians, and that is that if we are just evaluating patients with their typical history, physical exam, brain imaging, routine blood work, that at least in a primary care setting, that we're not very good at diagnosing Alzheimer's disease accurately. So a little bit better than a flip of a coin, not much better. If you get to secondary care, which means that the clinician has specialty expertise in diagnosing dementia, clinicians do a little bit better in accurately diagnosing Alzheimer's disease as the cause of a patient's cognitive impairment, a little bit better than 70%. But that's still not great. That means that we're still misdiagnosing over a quarter of our patients as having Alzheimer's disease as the cause of their cognitive impairment when it's really something else. What we also found from this study is that the blood test is unsurprisingly very helpful in telling us whether a patient has brain pathology due to Alzheimer's disease. So it's over 90% accurate in terms of corresponding to cerebral spinal fluid tests and helping to make the diagnosis of Alzheimer's disease. Overall, what this means is that if we use these blood tests, we can significantly improve our accuracy in diagnosing Alzheimer's disease as the cause of cognitive impairment, not only in specialty memory clinics, but also in primary care. Some other findings from the study include that they looked at performing blood tests as you go along in the course of a study. So they sent samples as you would in a clinic after each group of patients. And this is actually more challenging for assays to perform well because most research studies have waited till all of the samples were collected and then run them all at once. But in this study, they ran them as they went along in clinical care, and they actually found that the test performed as well. So it's possible to get robust results over time with the same cutoff, at least for the particular test that was studied. So this gives us confidence that we can use these blood tests as part of clinical care in a very rigorous way to help us diagnose patients.